In this video, I'm going to be talking to you about cervical checks during labour, otherwise known as vaginal examinations. Now, the reason that I'm so passionate about this topic is because I had a particularly uncomfortable vaginal exam during my labour because I didn't have the knowledge at the time to make the experience a better one. As a hypnobirthing teacher, my focus is on helping you to have a calm and comfortable childbirth. So in this video, I'm going to be talking all about vaginal examinations, why they're carried out, any risks that could be involved, and I'm going to be sharing my top tips on how you can have a positive experience of a vaginal examination rather than an unpleasant one, which is what I had. A cervical check is an internal vaginal examination carried out by your doctor or midwife, and it allows your maternity care team to assess how dilated your cervix is at a certain point in time and at what stage of labour you're in. It can also give an indication of how labour is progressing for you and the position of your baby. Before you have a cervical check, it's really important that you verbally consent to the procedure before it's carried out. That's because your care team don't actually have the rights to carry out the procedure unless you agree to it first. Before having a vaginal examination, your doctor or midwife will ask you to undress from the waist down, to lie down on an examination table or on your bed at home if you're having a home birth, with your feet together but your knees bent apart. During the procedure, your doctor or midwife will insert a gloved finger inside your vagina up to your cervix, and they may also feel the outside of your tummy with their other hand. During my vaginal exam, I was lying completely flat on my back, which made me feel dizzy because of the weight of my baby bump. So it's really best if you're in a semi-reclined position so that you don't feel faint. It's really important that you don't tense up like this during the cervical check and that you don't hold your breath, because that can cause tension and tightness in your pelvic area and make the vaginal examination painful. Also, if you get stressed during a cervical check, it can actually cause your cervix to close up, and that's disadvantageous if you're having a cervical check before being allocated a birth room. If you arrive at the hospital or birth centre and you're 5 centimetres dilated, but you get panicky during your cervical check, your cervix could close up to say 2 to 3 centimetres dilated. And then when your care team are assessing your cervix and they say, oh, you're under 3 centimetres dilated, they will then say, go home and come back when your labour is more advanced. So we really want to be as relaxed as possible during vaginal examinations so that your cervix doesn't close up, because we really want to avoid 2 trips back and forth to the hospital or birth centre. To help you relax during your cervical check, ask if the lights can be dimmed in the room that you're in so that the setting feels less bright and more private. Hold your partner's hand if you can for reassurance. Close your eyes if you want to, and keep your forehead, jaw, shoulders and pelvic floor muscles completely soft and loose. Also, breathe in slowly through your nose and out through your mouth. I'm now going to teach you a breathing technique that you could use to help you to stay calm and relaxed during any vaginal examinations. By breathing in slowly through your nose and saying the word open to yourself silently in your mind will help you to focus on keeping your cervix open. And then exhaling slowly through your mouth and saying the word release to yourself in your mind will help you to release any tension or tightness in your body. So let me demonstrate this now. So now it's your turn to practice this breathing technique. In a moment, I'm going to say the word open, and I'd like you to inhale deeply through your nose. Then when I say the word release, I'd like you to exhale through your mouth. We're going to do this breathing cycle 5 times, and we're doing it 5 times because that should carry you through from the start to the end of any vaginal examination that you could have during labour. Please make sure that your forehead is relaxed, your jaw is unclenched and feels soft and loose. Make sure that your shoulders are down, that your pelvic floor muscles feel soft. Just make sure that there's generally no tension or tightness in your body. Close your eyes if you think it's going to help you to focus, and just be guided by my voice. I will breathe with you. I might not be going at the perfect pace for you, but you can practice this breathing exercise in your own time and find your perfect speed. So let's begin. Open. Release. Open. Release. Open. Release. Open. Release. Open. Release. Well done. During labour, once you arrive at the hospital or birth centre, it's common practice to be offered a vaginal examination every 3 to 4 hours, but I want you to know that you don't have to agree to having one over and over again unless you want to. It's important to mention on your birth preferences how many cervical checks you're happy to receive. Most of the hypnobirthing mums that I teach agree to having 1 cervical check upon arriving at the hospital or birth centre, but they don't really want to have any more cervical checks unless it's medically necessary. Regular vaginal examinations are more justified if your labour's been really slow and your care team are trying to ascertain what's going on, if you've been induced, or if there are any labour complications. Generally speaking, the more internal interference that your body experiences during childbirth, the slower your labour progress is going to be. So it's really important to make an informed decision about how many vaginal examinations you're happy to receive. A cervical check can't tell your care team how much longer your labour is going to go on for, so don't let how dilated you are affect your confidence or positive mindset during labour. For example, when you have a cervical check, if you find out that you're 5 centimetres dilated, and since labour began it's taken you 12 hours to reach 5 centimetres dilated, that doesn't mean that it's going to take you another 12 hours to become fully dilated. It doesn't work like that. Dilation usually speeds up the more dilated you get. So don't let what you get told about how many centimetres dilated you are affect you during labour. Don't let it discourage you and don't let it negatively impact you, because the likelihood is once you've had your cervical check, you may become fully dilated very, very quickly. Sometimes that actually happens quite regularly in the hypnobirthing mums that I teach when I hear their stories about what happened after their cervical exams. Generally speaking, vaginal examinations are safe. They would only be considered risky if the hygiene guidelines aren't adhered to by your care team. So it's really important that your doctor or midwife washes their hands before doing the exam, that they wear disposable gloves, and that they carry out the cervical check in a clean room. A vaginal examination is not recommended if you have a low-lying placenta, if you're in labour prematurely, if your waters are broken before labour starts, or you're experiencing heavy bleeding. So just to recap, if you have a cervical check during labour, make sure that you give your consent first. Get into a semi-reclined position rather than lying completely flat on your back. Relax your body, close your eyes if you want to, and ask your care team to dim the lights. Hold your partner's hand for reassurance, and breathe in and out calmly and slowly, thinking to yourself, open and release. And remember, don't let how many centimetres dilated you are influence your confidence during labour. You could be fully dilated and ready to push shortly after having a vaginal examination. Your cervix knows what to do, so trust the process. I hope this video has helped. If you've got any questions about cervical checks, let me know and I'll get back to you as soon as I possibly can. This video is one module on my digital hypnobirthing course. If you and your partner want to feel calm, confident and prepared for your baby's arrival, check out my hypnobirthing course in the video description section below. Thank you so much for watching today and see you again soon.